Judith, there's been renewed interest in the regulation of NHS managers. As a potential solution, what is the problem that regulation might be designed to solve?
I think what we see in the NHS, it's a very large organisation, but with quite significant variability in terms of both how organisations are run, but also how individual managers actually perform their role. So I think what regulation would be seeking to address would be both instilling greater confidence actually in the public and in the NHS itself in the quality and performance of managers, and also I guess providing a benchmark against which we can assess whether or not managers are actually up to the job.
What is the role of employers in managing performance? I mean, if performance management was better, would we still need regulation?
Well, I think it's probably a case of both and. I mean, we see it with many of what I guess we consider as the traditional professions like law and medicine that have a very clear code of practice. They have clearly set out standards which the members of the profession are expected to meet in terms of the work they do or the care or services they provide. I guess what's slightly different about management is, of course, it's harder to codify what it is that managers do.
Yes.
And management jobs can be actually quite different even within the same organisation. However, having said that, management has very significant responsibilities in terms of patient care, in terms of performance of the organisation, both financially and from a patient safety and quality point of view. So I think there's an increasing sense, both amongst the public and in the NHS, that actually perhaps we're getting closer certainly to the time when NHS management perhaps should be considered more of a profession, should have some clearer standards about what's expected, and actually perhaps then be held to account against those. In terms of the performance management, I guess the question is against what is one judging performance? And there is an argument that says if we had a more firmly applied code of conduct for managers, we'd at least have some very clear and explicit standards against which to actually measure performance.
A nice link to my next question, because of course we've had a code of conduct for managers in the NHS since 2002. Has it really influenced behaviour? And if not, why not?
I think the both interesting and potentially difficult thing about the NHS code of conduct for managers is that I think we lack clarity as to exactly how it's been implemented within the health service. It's intended that the code of conduct is written into all managers' contracts and that it is something against which performance can be measured, and claims of poor performance could be made against that code. But we know relatively little about what the national, or even indeed sometimes the local picture is about that, the extent to which that code has been made real in practice, both in terms of how the code feels for individual managers, but also the extent to which the boards of NHS organisations are using the code as a way of assessing performance, and also the extent to which the public are even aware of the fact that the code exists. So a sense of we've made progress in having the code, but I think there are quite challenging questions to ask about its implementation so far.
Before we go down the line of making further regulatory changes, do we need to know more about how that code of practice is operating at the moment and how it might be strengthened?
Yes, I think there's actually a need for some almost basic research to find out the extent to which the code is written into managers' contracts, to find out from managers the extent to which the code is real and meaningful to them, the extent to which it informs their practice. And also, it would be useful to find out from managers and from boards and perhaps from patients and the public as well, ideas about the extent to which the code is still fit for purpose, because we're now 10 years from when it was first developed, and the NHS is going through some significant organisational changes at the moment. So I think the time is probably ripe anyway to review it and to think carefully about how it could perhaps be used to greater effect in the future.
there are other ways in which managers could be regulated. Could you tell us a bit about what those options might be, and your thoughts on their relative effectiveness?
I think it's quite useful to learn from international experience, actually, when we think about some of the options for regulating managers. For example, in countries such as the Netherlands and also Australia and Canada, they've moved towards developing quite a strong professional association for managers. That's often been developed by managers themselves, but has become an important body in terms of setting standards and a code of ethics for the profession, sometimes perhaps almost setting some barriers to entry to the profession, and then accrediting training and development, and also becoming an important source of networking and support for managers. I'm not sure we quite have the equivalent here in the NHS, so that's clearly, I think, something quite interesting for us to look to, because whilst it's probably a step short of formal regulation as we have for doctors or lawyers in this country, it's certainly taking us further along the road towards that more formalised approach.
Going back some time in history, we did have a professional body for managers, the Institute for Health Service Managers. What happened to that?
We did. It was an institute originally for health service administrators, which became the Institute for Health Services Management in the 1980s. And it was a body that accredited and indeed awarded what was considered at the time the main qualification for health service management, and again performed some of those functions I mentioned in terms of other countries, although perhaps not quite to the same extent that they do. Well, its influence waned really when we got into the 1990s, and managers have looked at a range of different bodies for their support and for their development, probably reflecting to some extent we've had increasing diversity in terms of the sort of managers we've had in the NHS, and organisations have become more complex. However, I think in the light of both the discussions of the Mid-Staffordshire inquiry and the increasing public expectations of people holding high office in public life, it probably is time to think again about ways in which we might accredit or even regulate health managers.
Are there approaches to the regulation or accreditation of managers that you think we should avoid?
I think what's probably important is that we do take some time to assess the operation of the code of conduct for managers we have at the moment, to think carefully about the way NHS boards are working, and also about the ways in which we recruit and vet people for management posts. Now, some of that work has been done in a report that was published in 2010 by the Department of Health, a report that was led by Ian Dalton. So we do have a body of analysis and work there from which to build. That report itself expressed some mixed feelings in the management community about whether or not we should move straight to very formal regulation of managers. And my sense would be that we certainly shouldn't rule out formal regulation, but we might need to move, as I've suggested already, to perhaps some stronger professional body for managers, look at setting some standards, making the code of ethics and conduct more firm and more real, and perhaps carry out some exploratory work about very formal regulation. But formal regulation is quite difficult to enact, quite costly to enact, and I guess we've got to be careful we don't take a sledgehammer to crack a nut type of approach, and also critically make sure that whatever form of regulation we go for, it doesn't become something that's felt as too punitive and actually could ironically sort of almost work against managers feeling they can be open if things are going wrong, they can seek help. Because I think there's something quite important about any move towards a more regulated approach, encouraging an open and learning culture in health management, because I think that really is critical.
Obviously the money side is important, because regulation is not a free good.
It's not, and we have to bear in mind as well that whatever steps we take as we move forward in terms of the regulation of health management, this is at a time when significant reductions are being made in management costs in the NHS for understandable reasons, but there's less money to actually spend on management and administration. We've got to be very clear and careful that it's being spent in the best way possible.
Judith, thank you so much for sharing with us the arguments for and against regulation.